Hello! Welcome back to our channel. Don't forget to subscribe and click the little bell icon so you get notifications of our future videos. Today's video I'm going to adjust Rhea. And she is 38 weeks and 6 days pregnant with our baby Isabella Helena. We can't wait till Bella is with us. It won't be too much longer now. This video is for her and also for you. A lot of people don't realize that when a lady is pregnant that a chiropractic adjustment is even possible. But more importantly, they don't realize at times it's extremely necessary.
It's really a big help in your back, hips, and your head.
Yes, Rhea's been having headaches and of course back pain from the change in the center of gravity. So, stick around. I'm going to use this heat sensing instrument. These are heat sensors to check her spine. Rhea has been having some numbness and swelling in her hands, which may be a normal result of the late pregnancy. But also it can be due to nerve pressure at the base of her neck. Whoa, there is a hot spot at the top of her neck. I know from previous experience she has a problem with the top vertebra, the atlas, being misaligned to the right. Misalignment is also known as a subluxation, which by definition means it has some involvement or irritation of the nerve, which can cause an interference to the normal flow of information from the brain to whatever part of the body that nerve goes to. Man, that is a hot tamale also. So the ligaments from the uterus attach right to the sacrum. There's a problem right there. So now I am going to palpate her spine, actually feel the position of the vertebrae, and as I do this to see if there is a restriction of the joint motion, which is also characteristic of subluxation, or what is known as misalignment, commonly here in the Philippines especially. Right there, that atlas is stuck. And right there at T1. First thoracic, or sometimes I call them the rib vertebrae because the thoracic have ribs attached to them. T7. L1. And her right sacroiliac joint. At the level of the third sacral segment. And I'm feeling the third sacral tubercle. So because she's pregnant and I don't have a table called the knee chest table, I'm going to have her sit on the end of the table. To adjust her thoracic vertebra. Inhale and exhale. Did it hurt? No?
Just a big crack.
Just a big crack. Okay. I'm going to have you lie on your side. I was pretty sure she was going to say no when I asked her if it hurt. So again, this is a modification of what I might usually do for this upper lumbar vertebra, the first lumbar. So I've got my fingers on the spinous process of the first lumbar. I'm going to traction it down. I've got her knee moving to where I can just feel the spinous move, and then I'm backing off a little bit, holding that position, and it just released. Which right now, that's all I am hoping for, is a release. That will allow the muscles around that area to relax and be more comfortable. In the Philippines, we often pronounce that word comfortable. And I am actually contacting her sacrum, the sacral part of the sacroiliac joint, right next to or adjacent to the third sacral segment. Not much happened there today, but I will not force it. So I'm going to adjust that first thoracic vertebra. That was beautiful. That should help that swelling and numbness in your hands that you've been having. And then this is the atlas vertebra. It's actually an ASRA, so I'm going to turn the head slightly to compensate or remove the anteriority of that segment during the thrust. That's a girl. It wasn't a double clunk, but it was a good solid clunk. So I believe she is going to feel much better. One reason I'm making this video is people need to know that during pregnancy, adjustments are not only possible, but sometimes extremely necessary. Earlier in her pregnancy, the baby was in a breech position, transverse like this. Now Bella's head is down here where it should be, getting ready to be born naturally. God bless. Thanks for watching. Don't forget to subscribe and click the little bell icon so you can get notifications of our future videos. God bless.
Bye.